Welcome back, and happy Mother's Day, Richard.
Happy Mother's Day to you too. That sounds like an odd way to start the day, but here we are.
It does. Now the podcast isn't really necessarily about Mother's Day specifically, but of course we can't post a podcast on Mother's Day without saying Happy Mother's Day.
Mother's Day, right?
So we're going to talk a little bit about moms in the podcast, but because we're going to talk about the some of the additional impacts that that COVID-19 has had on us as a country, as people, and what influence it has had, especially on our mental health. And there's been some new reports that's come out that are talking about this, and the figures and the implications are really striking. And
yeah, they really are. I saw this. It says our mental health crashed in 2020, and recovery could take years. So we knew it's been that mental health problems have increased. We've talked about it before.
Right.
We're reading about it, but then you say recovery could take years, and that struck me. Okay, well, what is that about? So I encountered the title, and I thought I got to maybe take a closer look at this and see what he's talking about. And then I wanted to see who wrote it.
Yeah.
And so I went to the author. His name is Daniel Van Boom. Boom, like boom. Boom.
Mm-hmm.
And so I thought, well, who's Daniel Van Boom? He's an Australian, Sydney-based news editor.
Right.
And normally we write these bios ourselves.
Mm-hmm.
People say, well, give me your bio.
Yeah.
So he wrote this. He said, Daniel Van Boom is a Sydney-based news editor. He excites people with his last name and then promptly disappoints them with his personality. And I thought, I need to know more about this guy.
So it's like, despite the wittiness of that line, he's trying to say that his personality isn't quite as explosive.
Exactly. So I thought anybody with that kind of sense of humor and self-effacing attitude has to be worth reading. Yeah. So I thought, well, let me take a look at this thing. And as I read it, it's quite a lengthy article, by the way. It's a little bit longer than what we usually post. But it's fairly long, a lot of data, a lot of statistics and numbers. Right. But don't let that deter you. It's probably worth reading. Okay.
Yeah, and I guess we should sort of start out by saying that we're still getting data, right? A lot of times when we're talking about, especially health-related or mental health-related data, we will get data this year, but the data is actually from like 2 or 3 years ago. So exactly. The data will be trickling in as we look at the overall effect that COVID-19 has had on our physical health, our mental health, housing, all those different things. But when we just look at sort of hard data, anecdotal data over the past year and some change since the COVID crisis hit, it's striking, and it warrants a discussion.
Exactly. And he begins the discussion with a particular person, a guy by the name of James, who lives in England. He's a computer software engineer, lives in England, and was diagnosed with depression in 2017. Yeah. And so he talks about his, James goes into therapy and working with a therapist, and he begins to recover by 2019, okay, which is fairly typical. And then COVID hit. Mm-hmm. And when COVID hit, first of all, we know that depression and anxiety are related to each other. Mm-hmm. And the first thing that happened is James got overwhelmed with anxiety because now he's thinking, well, I'm going to get infected. I'm going to die because those are the early days of the pandemic. And also he said, or I'm going to make other people sick. And I don't know whether I had forgotten about that, but we all worried about getting the illness because it was so mysterious in the beginning. But we also worried about giving it to other people, getting it from our kids, getting it from our partners. And so he was overwhelmed with anxiety. Then the next thing is we have lockdowns.
Right.
And in England, they had a big lockdown. And that imposed on James this numbing isolation, which is what the lockdown did. You went into lockdown.
Yeah.
Really,
Yeah. And I can absolutely see the effect that it had and appreciate the effect that it had on James with this example, because, you know, we've talked many times on the podcast about how, you know, when you're dealing with depression, it's really important to socialize and to get out with other people and sort of
right,
do the opposite of what the depression is trying to make you do, which is to isolate and stay alone and all that kind of stuff.
right.
And so you do all of those things during recovery, and you're going out and interacting with others. So to be in a situation where now you're on lockdown and you have to stay home, I'm sure that I can absolutely see how that would have an opposite effect on a person trying to recover from depression.
Right. And that's exactly what happened to James, is that his therapy was to get out, to get to know people, to move out, get back out into the world, which is exactly what we tell people. If you want to deal with depression, get out of the house and get going. Now you're on lockdown.
Yeah.
And some people were on lockdown for months or years. So James relapsed. I mean,
Sure.
all the gains that he had made disappeared. And there he was back where he started. So he has to recover. And if you think about it, and we've said many times that about 20% of people meet criteria for a mental illness.
Right.
So all those 20% of their symptoms were exacerbated by the impositions of of the pandemic,
Right.
the anxiety, the depression, the isolation, the fear that you would get it. And so all of these people, all of us who were suffering from mental health conditions, our symptoms were made worse by the pandemic.
Right.
Those who were not diagnosed or had fewer symptoms or mild symptoms suddenly began to discover what people with depression and anxiety are going through, because we all suffered from that kind of isolation. Okay.
Yeah, absolutely. And so we've heard sort of individual reports like James's, where people who were either doing well or were starting to sort of slide back, you know, at the beginning of 2020, you know, as soon as COVID hit and those restrictions came and all of the other things that came with that, you know, their symptoms worsening. And whether it's depression or anxiety or paranoia, you know, we've seen so many of these symptoms significantly increase. And that's in adults and children and adolescents. We're seeing it all over. You know, we'll get into some more data and everything, but I read an article recently where there's a school district in Las Vegas that has had to deal with 19 student suicides since the pandemic hit. So within a year, they've had 19 students commit suicide in one school district in Las Vegas.
Right.
But I mean, that's huge, you know? So it's, you know, it is having a profound effect on our mental health.
Right. Yeah. And so your story about the school district in Las Vegas and James's story and many, many other stories like it illustrates that the pandemic has created this mental health havoc across the world. I mean, this isn't just the United States. And as it struck, there was a decline in mental health in many countries. And it's been reported in something called the 2021 World Happiness Report.
Right.
I didn't know about a World Happiness Report, but you know those articles that you read about what's the happiest, what population is the happiest in the country, and who are the happiest people? That's from this World Happiness Report. So it's not a joke. It's actually data that are collected they're collected on a year.
Well, and it sounds very fluffy and all that kind of stuff, but really, I mean, what it's getting at is like quality of life and satisfaction with where you're living and the economics and your work and family and all those kinds of things. So it really is an important finding or an important report to read.
Because when states or cities cities get rated, and cities get rated on quality of life issues and how do the citizens feel and where are the people happiest about their life. And so the World Happiness Report is a serious report. Okay. So the remainder of this article, he goes through
a lot of data.
A lot of data from different countries, different types of data. And we thought, well, let's just summarize a few of them and you get a flavor for what what we mean by mental health difficulties.
Right.
So there's a CDC report that would be from the United States that 42% of respondents said that they had increased symptoms of depression, of mental health issues, and that 31% the symptoms were serious enough that 31% sought professional help. So it's not just a little; it's enough to get professional help, and that's a 200% increase.
Yeah, and I think that what's really important with that is, okay, so, and this is the way that I read it, and you can tell me if you read it differently, because I've read some similar reports from even before the pandemic, that, when you think about the number of people who suffer from mental health issues,
Right.
And so in this report, there were 42% of the respondents said they had a significant increase in symptoms. Of those 42%, only 31% of them received mental health treatment.
Right.
There was a report from 2017 that, again, thinking about adolescents, that about 13 to 14% of those youth had a major depressive episode within the past year or so. But of them, only maybe 40% maybe received treatment.
Right.
So we're talking about a relatively large number of people, in this sample, 42%, and the one from 2017 before the pandemic, it was 13 to 14% of youth. But less than half of the people with these mental health issues are even receiving treatment. And that's a huge concern. And the pandemic did make that worse, because offices were closed and everything moved to teletherapy.
Exactly. Right. So you have in this group, you have this 200% increase, 31% of respondents. In other words, almost 1 out of 3 are saying I'm having symptoms. Okay, 30% of us. And so, as it turns out, this Luana Margus from Harvard Medical School said that means that 1/3 of the world's population is feeling this. And she said, imagine if 1/3 of the world's population had pneumonia, or 1/3 of the world had asthma, or 1/3 had some physical illness. We would be panic stricken. Okay.
Right.
1/3 of the world's population is suffering these effects. Okay. And then he goes on to say that the pandemic has exerted, has had 3 effects. One is that it has created anxiety that we will either get the illness, or that we will give the illness to somebody else. So we have increased anxiety. Then we have increased social isolation during lockdowns, and that creates depression. And then the third is financial pressures. And financial pressures were not experienced by everybody, but they were experienced unevenly. There's been a disparity in those who have experienced financial pressures. I remember when the pandemic first hit, many people lost their jobs, as restaurants closed and businesses closed. My son was working for a company in Austin, Texas, and the work that they did, they could not do in isolation. It was work that you had to go to places. It was a construction kind of company, and you had to go. They just shut down. They said, we can't do business in these circumstances. So they just closed the doors, shut the doors.
Remember that there was, even in our relatively small town in Central Florida, there was a time early on where, like, you were expected to stay home, and remember, we had to have notes that so if we were stopped by police or whoever, to say, hey, we're
that's right,
healthcare providers, and we are still going to work, and we're helping to treat patients and stuff. So I can imagine that, certainly the data suggests that there were a lot of people who lost their work and employment at those times. And, remember that anxiety and depression, though they oftentimes present together, those are 2 of the most common mental health conditions. And so when you're talking about something like COVID and the social isolation in our sort of social response to COVID, all of those things would exacerbate anxiety and depression. And so all of these people, that huge portion of the population that already is sort of predisposed for those things, when COVID hit, it only made those things worse.
Right. And when we talk about financial pressures, because I can remember my son's reaction when they closed his company. Now he's been able to do other things, but many people can. But the interesting note with financial pressures is, and I did not know this, suicides increase by 1% for every 1% rise in unemployment.
Yeah.
And we have watched the unemployment rate rise and fall during
Right.
this pandemic by more than 1 percentage point. And
Right.
so when you realize that suicides are correlated to unemployment rates, you begin it becomes a much bigger concern.
Yeah.
So
Yeah. In the suicide rates, speaking of that, other data that was presented says that shows us that the suicide rates did significantly increase in particular populations, especially.
right,
Um, it was, I think it was by October of last year, um, over 2,100 was it Japanese people had died from suicide, which was more than the number of people who had died from COVID
in the same period.
in that same time period. So it's like,
Imagine that.
um,
I mean, imagine that more people died of suicide than died of the pandemic,
right,
but these were pandemic-related suicides.
yeah.
Yeah,
And so the government created a minister of loneliness,
right,
um,
right,
which is a fascinating response. I think it'll be interesting to see what the long-term effect that has on the population. But could potentially be a wonderful response to
right.
such an event, to create a division of the government that works to address those issues.
Right. Yeah, I love the response to that. I mean, you think, what is a minister of loneliness? But that's a mental health issue. And
Right.
we're talking about this is a country that has stepped in and said we need to do, recognizing that there's a problem, stepping in and doing something about it
Yeah.
rather than arguing about it.
Yeah.
Now, curiously, the suicide rate did not go up in the United States.
Right.
For some reason, it didn't increase significantly in the US. But what did increase and what has created a problem for us is drug overdose deaths.
Right.
That's where it's reflected in the US, is in drug overdose deaths, not suicides, drug overdose. And the statistics here are alarming.
Yeah.
From August 2019 to August 2020, there were 52,000 deaths from overdosing on synthetic opioids.
Right.
Um, and again, you have to wonder, probably what happened is that people who were struggling with addiction
Hmm.
got much worse because of the pandemic,
Right.
because of the impositions.
Right.
And people who were on the verge of, or perhaps close to experiencing mental illness, it was enough to push them over the edge.
Right.
And so in this country, the problem was deaths by opioid overdosing. Okay.
Yeah. And we have certainly, we've seen that even in our area, reports of, significant numbers of people who have died of overdose from opiates.
Right.
But when we think about this significant increase in depression and anxiety over the past year, especially, what we do know, just like we talked about with COVID before, the COVID virus itself, anxiety and depression seems to be disproportionately hitting certain populations, certain groups of people, and those people, as we talk about it, it makes sense that it's these individuals. It's the women, the poor, and young people.
I was surprised with the young people.
Yeah.
We've been hearing about disparities among people of color and among women, but I did not know about young people. So
Right.
This was a revelation to me.
Yeah, and I think that there's been data sort of trickling out related to this, but 66% of kids 7 to 15 years of age had clinical signs, clinically significant signs of anxiety and depression.
Right.
And usually it's about 20 to 30%.
Right.
But 66%, I mean, that's two out of three.
Right. That's right.
That's huge.
Right. And it's not just here,
Right.
that's in the US. In France, it was the same thing. They did older teens and young adults, ages 18 to 24, and the rates doubled between April and November.
Yeah.
Okay. China, the same thing, a 50% increase in depression in adolescents. So if you look worldwide, not just in the US, but if you look worldwide, you see these really significant increases in anxiety and depression and other mental health issues in young children and teenagers and young adults. So this group from 7 to 25 has been adversely and disproportionately affected by the pandemic.
Right. And I think it makes sense that certain things, it's difficult to understand initially perhaps, but then as soon as you start thinking about some of the circumstances,
Right.
it does make a little bit more sense.
Mhm.
This is the population that has least control of their
Right.
environment, right?
Right.
So, as soon as March 2020 hit and things began to lock down, you
Right.
know, they were no longer going to school. They were no longer seeing their friends. They were no
Mhm.
longer able to go outside and play. They were no longer able to, go to the movies and do the things that
Right.
kids and teens do.
Mhm.
Um, and so between the school closures and the lockdowns, it really took a toll on peer relationships. And Richard, how many times did you talk to a teen and maybe you would have never imagined hearing a teen say, "I'm just kind of getting bored with playing video games"?
Right.
I would have never imagined hearing it as much as I did, by summer of last year.
Right. And the disruption, I remember 2 weeks off at holiday time. You didn't really want to go back to school after being off for a couple of weeks, right? Or you have summer vacation. There were kids who left class during spring break. So that was March of 2019 and
2020.
2020.
Yeah.
Yeah, 2020,
Mhm.
and didn't return until January of 2021.
Right.
I mean, I would have had a horrible time
Dude,
adjusting to that.
I just called you dude. Dude, we just had, of course, I'm working in the schools. The third semester, I'm sorry, the fourth quarter just started. Like 4 or 5 weeks ago, about a month ago.
Right,
We had some students at a couple of my schools. We had some students returning to school for the first time from
right,
e-learning. So
right.
not only was it from March of last year, but it was from March of last year until, April or so of this year. So a full year out.
Right. And we know the most important thing to kids is peer relationships. This
Right.
is when they're moving out of their families and beginning to affiliate with kids their own age.
Right. Peer
And you take that
relationship,
away.
structure,
Right.
routine. Those are the things that are really important. And they lost it for
It's all
a
taken.
year.
Right, right. And so young people have been affected disproportionately. And the other problem with young people is that the effects, what they're feeling right now, may manifest later.
Right.
It may not really appear until later on.
Right.
And so you have this, that's what he means by this is going to be a long, long recovery.
Right.
Okay.
Yeah.
Um,
When you think about the effects that it has on kids,
right,
with the school closures and the isolation, all that kind of stuff, then it makes sense that another group that is disproportionately represented or disproportionately affected are mothers, women,
mothers, right,
because they tended to be the ones that stayed home to manage kids at home.
yeah. Mothers again were disproportionately affected at a rate of 3 to 1. So happy Mother's Day, because you guys have had a tough year. Okay.
Absolutely.
Women were affected at a rate of 3 to 1. They were the most affected by school closings because it was just expected that mom would
Mhm.
stay home. Now that the kids were home, many mothers had to voluntarily give up employment
Mhm.
or change their schedules to be home with the children. Um, and women in the workforce, the number of women in the workforce is the lowest since 1988. And that's that's a long time ago.
Yeah.
Uh, and it's the lowest rate since 1988. Also, we know that women tend to be in those occupations that were most affected. That would be the restaurants, maintenance, cleaning the sort of hotel. And in our area, when Disney closed, its hotels, those hotels are cleaned and maintained by women. And all of those women lost their jobs during the pandemic because when Disney closed. There's also been an increase in domestic violence, and we hear about that occasionally, but then we forget about it. But the other thing that affected women was the increase in domestic violence.
Yeah.
And these numbers can be staggering. There was a 25% increase in Argentina, 33% in Singapore, and 300% in China, okay? In Japan, there were over 130,000 cases. That's the highest on record. And so women were not only affected with unemployment, with managing the homes, taking care of the kids who weren't in schools, but they were also the victims of domestic violence. And we can't forget about that. There again, those are going to have long-term effects.
Absolutely. Absolutely. Okay. And so, and we kind of alluded to this earlier, when we think about different populations of people who are disproportionately affected, we think about despair. And when we think about something called deaths of despair or suicides from despair, we're talking about people who are experiencing some of these mental health conditions and end up dying of suicide or alcohol poisoning or substance abuse overdose and things like that. And you said this earlier, but while the suicide rates itself has not increased in the United States, as far as the data that we have so far, these deaths from despair has significantly increased, somewhere between 50 and 100% over the past year.
That's right.
Yeah, that's staggering.
Right, and I like this concept of deaths of despair because we talk about of the malaise or other words that we've used to describe languishing. We did a talk about languishing a few weeks ago, and so it's all about despair. These are called deaths of despair, and we track deaths of despair by suicide, alcohol poisoning, and substance abuse. And as you said, suicides haven't increased, but substance abuse, deaths by substance abuse and alcohol poisoning have increased dramatically in this country. Almost, we're talking about 52,000 deaths. If you don't believe this, talk to your local medical examiner. Just call up your local medical examiner and say, "Hey, what's going on?" And you'll get an alarming description of what medical examiners are dealing with since the pandemic has struck.
Right. Absolutely. And those kinds of effects especially hit the lower socioeconomic status, hit poor people much harder than it does other groups. And whether it's because of lack of support services, less or fewer coping strategies and things like that, but it does hit that population with much greater rate than other groups. So
exactly.
It's unfortunate.
Yep, they have been disproportionately affected. So there's this, now he talks about the long view. The long view is really two things. One is, we all know about long COVID or long haulers. We've heard that term. There are people who continue to have physical symptoms, respiratory, cardiovascular. In fact, there was and GI problems. There was an article published just yesterday that COVID is a cardiovascular disease. The mechanism of action affects your cardiovascular system. The immediate effect is your lungs, but it really is a cardiovascular problem. I'm going to have to read more about that because that's, again, a recent discovery. So we have people who continue to have physical symptoms. Those people are going to continue to have mental symptoms. Okay, so with the physical comes anxiety, depression, sleep disturbance if you're sick. So all that, the long haulers are also going to be experiencing mental health issues. Right. But the other thing is PTSD. And again, these are informative statistics. If you go back to 9/11, 12% of first responders had PTSD as late as 2011. So 10 years later, they were still struggling with PTSD, 12%. We had a SARS outbreak in this country a few years ago. 33% of the SARS patients had PTSD. So now we have much larger numbers of COVID patients. And if you think about 33% of the people who got COVID and survived could experience PTSD. When we talk about teenagers, this could appear later on, or people who were sick at age 30 might still be struggling when they're in their 40s.
Right. And especially with, teenagers and adolescents, because the effects that it has on them and has had on their lives, it could continue to manifest, for many, many years into their future. So the latent problems that this could cause mental health wise, we have to keep that in mind.
Okay. So we have this tsunami of very discouraging statistics, alarming, but they're informative statistics. Okay. So yes, it's alarming, but it's not depressing. These are not depressing statistics. They inform us about the challenges that we face. And this writer, Boone, said that we have reasons for optimism. Right. One is online therapy has made therapy more available to more people.
Right.
Okay? People who wouldn't be able to access therapy prior to the pandemic are now able to do so. And all of us are accustomed to online therapy. That's a sign for optimism. Second, more people have experienced mental health effects, mental health problems. And so more people are sensitive now to say, wow, this is a real thing. Right. People are struggling. I remember when I felt anxiety, when I felt depression. So the additional awareness will lead to additional sensitivity. Right. And that we're hopeful, but the future will not be the same for most of us. We are all beginning to experience hope.
Right.
Okay. With the vaccine, with the numbers going down, we are all beginning to get hopeful that perhaps we're finally moving out of this, out of the restrictions, out of the masking, out of all the things that we've had to live with. But it's not going to be the same. We're not going into the old world. Right. We're not going back to where we were.
Right.
We are still going to be affected by what's happened in the past 18 months.
Yeah, and I think that that's all part of the overall take-home message that we want people to take from this podcast is that mental health problems have significantly increased over the course of the past year, but things like masks and social distancing and all those things, these are part of the reality now that we're living with, and we need to work towards accepting some of those things, as opposed to there are people who keep fighting against and pushing against that, which only makes the mental health problems even worse, because now we're talking about anger and we're talking about frustration and anxiety. So we need to get to a point where we can accept that some of these things are the way that they are now, and it's into the foreseeable future. We don't know how long it's going to be that way.
Right. Yeah, because we talk about, throughout this entire pandemic, we've had all this talk about, well, it's a hoax. First, it was a hoax, and then it wasn't real, and then it was not serious. And we've had all these arguments and issues, and we know it was politicized. We've been through all that. But look at India. Look at Brazil. I mean, India right now is completely overwhelmed. Okay, right. This thing is not over, and it is real. But now the real is mental health. Now we're going to have to deal with the mental health consequences of this illness, and the mental health consequences are overwhelming, and they're very, very real for half the population.
Right.
So, if you had a pre-existing condition that got worse, If you didn't have a pre-existing condition, you may be experiencing mental health problems for the first time in your life.
Right. And especially among those groups who are disproportionately affected, like women and poor people, people in that lower socioeconomic status, and younger kids and adolescents.
Yeah. Remember that some people have been more affected than you may have been affected. I hear people still laughing about, making jokes about, well, the, you know, this was not a big deal, or this wasn't real, or we shouldn't have been wearing masks. Remember that some people have been far more affected by this than others. And please try to remain sensitive to them. I mean, maybe
Right.
you weren't, but others were. And they
Right.
include women, the poor, and the young.
Yeah. And by doing that, hopefully we can decrease some of the additional effects, mental health effects that this has.
Right.
The more that we argue and complain and offend each other, the more mental health problems we're going to have. And so we need to keep those things in mind.
Yeah, and if you're struggling with anxiety and depression, and somebody tells you, "Oh, this was all a big joke. This was all a hoax. This was never a problem." Well, your depression and anxiety are a problem. That for you, that's a very real problem. And to be told that it's not a problem, or you shouldn't be worried about it, makes other people's mental health much worse. Okay,
Right.
so if you were fortunate enough to have been spared COVID,
Yeah.
okay, consider yourself blessed. I mean, God bless you that you weren't affected by it.
Mhm.
But rather than viewing your good fortune as just additional evidence that COVID was a hoax, or it was never the problem we were told it was, just think about all of the people who have been affected. Over 500,000 people died. That's 500,000 families that
Mhm.
have been affected by this thing. Look at Brazil. Look at India, what they're going through. Consider yourself fortunate, but don't use your good fortune to minimize what has happened in the past 18 months.
Yeah, absolutely. We're all struggling in different ways. Um, and we need to keep that in mind and remember that we're part of a society, part of a group, a collective. And one person in some of these situations, one person can make a difference, because if you are protecting yourself, each person that protects themselves is protecting many other people. And
Right.
so, wearing your mask and being mindful of the things that you say and the things that the sensitivity that you're sharing with other people, and it's important and can go a long ways, not just to prevent the ongoing spread of COVID, but also to help minimize or to lessen the mental health effects that all of this has had on everybody.
That's right. Because early on in the pandemic, we asked people to be sensitive to the morbidity and the mortality, people who died and got very sick with COVID. And so there were people dying, and there were people getting very, very sick, and there were people who still are very, very sick
Mhm.
from COVID. And yet we had large numbers of people saying it's a big joke, or it's a hoax, or it's not serious, or this is stupid, we shouldn't be doing this. Um, Imagine how that made people feel who were affected directly, or through other family members. And now we have the same issue with mental health issues. Let's be sensitive to people who are really struggling during these difficult times. We do that. We owe that to each other.
Absolutely. So, all right. Well, I think that is it for today. Until next time, stay happy, stay healthy, and forget to be afraid.